Okay, so your provider is sending you home on the medication Metoprolol. The brand name for this medication is Lopressor, and the generic name is metoprolol succinate. This medication can be used in patients who have hypertension, stable angina pectoris, and to help prevent reinfarction in patients who have had a myocardial infarction. So that means that it can be used for patients who have high blood pressure or stable chest pain due to a blockage. The medication works is it blocks beta receptors in the heart and the kidneys that cause the sympathetic nervous system from causing an increase in blood pressure. And that stops the heart from becoming more excitable. It also works to decrease cardiac output, which decreases the cardiac workload and decreases your blood pressure. This medication is taken directly with food or immediately after eating. The medication should not be chewed or crushed, but if your doctor has prescribed you a dose of medication that requires you to cut the pill, you should use a pill cutter and only cut where the pill is scored. With this medication, you need to make sure that you check your pulse before taking the medication. If your pulse is less than 60 beats per minute, then you should not take this medication. You should hold the dose. Of course, you can always call the provider if you have any questions. If you also have diabetes, this medication could change your glucose levels when you're taking your blood sugars. So when you start this medication, we need to make sure that you're checking your fasting blood sugars more often than you normally would to make sure that you can accurately regulate your blood sugar levels. We also need to monitor your blood pressure when you're on this medication since it works to decrease your blood pressure. When your provider decides to take you off this medication, we need to make sure that you are tampering down your dose, meaning you are not stopping it immediately. You take a little bit less every day and you gradually reduce the amount you're taking over about a week to 2 weeks. Because you don't want to stop taking the medication suddenly. If you do stop taking the medication suddenly, you could experience an exacerbation of pain in your chest, also known as angina, or even a myocardial infarction, which is also known as a heart attack. You should avoid driving and other things that require mental awareness while taking this drug, especially until you know how it affects you specifically. It's also a good idea to notify any other providers that you are taking this medication, including your dentist, because it could affect your care with them, especially if you're planning any other surgeries. There are not any studies that have currently been done on any patients who are taking this medication and pregnant, so make sure you notify your provider if you are planning on becoming pregnant or if you find out you are pregnant. Some common adverse effects are fatigue, dizziness, headache, insomnia, mental confusion, and changes in level of consciousness. It can also cause bradycardia, which is a slow heart rate, or heart failure, edema, palpitations, and stroke. It can also cause bronchospasm, dyspnea, and wheezing, so shortness of breath. You should call your provider. If you are experiencing any shortness of breath, it is very important that you call and let them know what's going on. It's also important to withhold this medication if your heart rate is below 60, as previously mentioned, but you should notify your provider if your heart rate is below 60 beats per minute as well. So let me know if you have any questions, and I will list my references. Thanks.